Right now, if you wake up with a fever, you know exactly what to do. You take a pill, you drink water, you maybe Google your symptoms for 20 minutes and convince yourself you're dying. Then you sleep it off, and within a few days, you're fine. But here's something nobody ever stops to think about. For 99% of human history, there were no pills, no hospitals, no doctors. For over 300,000 years, when a human got sick, they had nothing. No antibiotics, no surgery, no diagnosis, just their body, their tribe, and the world around them. And yet, we survived. Not just survived, thrived. So what exactly did they do? Because the answer isn't what you think, and some of it, science is only now beginning to understand. We're going to look at 4 things ancient humans actually did when sickness hit. Let's start 300,000 years ago. You're in a small group, maybe 20, maybe 30 people. You live, hunt, and move together. One morning, someone in your group can't stand up. Their skin is burning. They're shaking. What happens? For a long time, scientists assumed the answer was nothing. That ancient humans simply left the sick behind. But the archaeological evidence tells a completely different story. In a cave in Shanidar, Iraq, researchers discovered the skeleton of a Neanderthal man. He was at least 40 years old, ancient by prehistoric standards. But here's what made him remarkable. His arm had been amputated above the elbow long before he died. His eye socket showed signs of a healed injury that likely left him partially blind. One of his legs was withered, almost certainly unusable. This man could not hunt. He could barely walk. And yet, someone fed him. Someone took care of him for years. That means that even 60,000 years ago, before civilization, humans already had caregivers. The first healer wasn't a doctor, it was just a person who chose not to leave someone behind. That instinct, that choice to stay and care, is the oldest medicine in human history. At some point, ancient humans started doing something else, something that required observation, memory, and thousands of years of trial and error. They started using plants. Now, before you picture someone randomly eating leaves and hoping for the best, the reality was far more sophisticated. Researchers studying the Otzi the Iceman, a 5,300-year-old man found frozen in the Alps. One of them, Piptoporus betulinus, is now known to contain compounds that fight intestinal parasites, which Otzi happened to have. He wasn't just carrying random things, he was carrying targeted medicine. 5,300 years ago, across the ancient world, the story is the same. Willow bark, which contains salicylic acid, the active ingredient in modern aspirin, was used in ancient Egypt, ancient China, and by indigenous peoples across the Americas. Turmeric, used in Ayurvedic medicine for thousands of years, is now studied by pharmaceutical companies for its anti-inflammatory compounds. Garlic, found in Egyptian medical texts dating back to 1500 BC, is now confirmed to have genuine antibacterial properties. These weren't accidents. These weren't superstitions. These were the results of thousands of years of watching and passing that knowledge forward. Ancient humans had no chemistry labs, but they had something just as powerful: time. Thousands of generations of observing the natural world, learning which plants reduced fever, which ones stopped bleeding, which ones eased pain. Here's something modern medicine is only recently starting to measure properly. Being around people changes how your body heals. When you're sick and someone sits with you, your cortisol levels drop, your heart rate slows, your immune system gets a small but measurable boost. Ancient humans didn't have a name for it, but they practiced it instinctively. When someone got sick in a tribe, the group would close in. People would stay close. They would talk, touch, and sit together. And it turns out that physical closeness wasn't just emotional comfort, it was biological medicine. Studies done on chimpanzees, our closest living relatives, show that when one chimp is injured or ill, other chimps will actively groom, protect, and feed them, sometimes at risk to themselves. This behavior is ancient. It predates modern humans. And the reason it evolved is simple. It worked. Isolation, the thing modern people often choose when sick, was actually one of the most dangerous things an ancient human could face. Not just because of predators, but because the body heals faster when it doesn't feel alone. Now we get to the part that sounds the most unscientific, but might be the most important of all. Every ancient culture had some form of ritual healing: chanting, dancing, ceremony, prayer. For centuries, modern scientists dismissed this as primitive superstition, people who didn't understand illness turning to magic because they had nothing else. But then researchers started measuring what actually happens to the body during these rituals, and what they found changed everything. When a person genuinely believes they are being healed, when they feel held, seen, and cared for within a ritual, their body begins to produce endorphins. Their pain thresholds rise, their immune markers improve, prove. In clinical trials, placebo treatments, fake medicine with no active ingredient, have been shown to produce real, measurable physical improvements in conditions ranging from pain to depression to Parkinson's symptoms. The brain doesn't just believe it's healing, it actually begins to heal. Ancient shamans and healers didn't know the neuroscience, but they discovered this truth through observation. The ceremony wasn't a replacement for medicine. For ancient humans, the ceremony was the medicine. So let's go back to where we started. You wake up sick, you take a pill, you feel better in 3 days. Modern medicine is real and it is remarkable. Don't misunderstand this. But the next time you're sick and someone brings you food you didn't ask for or tells you you're going to be okay, understand that that is not a small thing. That's 300,000 years of medicine. The plants became pharmaceuticals. The tribal healers became doctors. The rituals became therapy. But the most ancient medicine of all, the choice to stay, to care, to make someone feel less alone, that one never needed an upgrade. It worked then, and it still works now.